Hi guys, good afternoon. Welcome back to my YouTube channel. This is Miss Henderson. So today I am going to be reading some questions, some EKG questions for you. These questions can help you pass your EKG exam. So that being said, I'm going to be reading these questions from my handout. So I have all the questions here. So let's dive into these questions. They're very interesting questions. So the first question we have here, your patient, Miss Resina Trope, calls you into her room with complaints of dizziness, nausea, and diaphoresis. When you look at the monitor, you see the rhythm as complete heart block. The appropriate treatment for this rhythm is... So guys, the correct answer for question 1 will be the application of an external pacemaker. That will be the correct answer for question number 1. So let's look at another question here. We have another question here states, which of the following action would you carry out first? If your first patient is noted to be in a second-degree heart block, so what would be the appropriate action? A, prepare for defibrillation. B, call the MD. C, obtain a 1-minute strip. Or D, assess vital signs and mentation. So D will be the correct answer for question number 2. So guys, we have question number 3. Question number 3 states, sinus tachycardia may be seen as a response to A, anxiety, B, pain, C, dehydration, or all of the above. So the correct answer for question number 3 will be all of the above, sinus tachycardia. Alright guys, we have question number 4. Question number 4 states, a delay in conduction of the AV node is manifested on the EKG by A, prolonged PR interval, B, a widened QRS intervals, C, an inverted P wave, or D, absence of a P wave. So the correct answer for this question would be a prolonged PR intervals. That's the correct answer for this question. Alright guys, we have one more question here. Is that this question states, upon recognizing that the patient is in sinus bradycardia, the best treatment plan will be A, CPR, B, administer atropine, C, administer epinephrine, or D, external pacing. So the correct answer for this question will be external pacing. That's the correct answer for this question. Guys, this is it for this video. So I just had a few questions. If you like these types of videos and these types of content, please consider subscribing to my YouTube channel. Please like and share and give this video a thumbs up. Thanks for watching. Hello guys, good afternoon. Welcome back to my YouTube channel. Thank you again for tuning in. This is Miss Henderson. I want to extend my greatest gratitude for my returning subscriber. Thank you so much for subscribing to my YouTube channel. Thank you so much for sharing these videos. And I hope these videos are providing you with some insight in the CNA world. These videos are just meant to help CNA students to pass their CNA Prometric exam, help them to get their certification and to be gainfully employed. I'm so happy that I can provide some value for you, and thank you again so much for subscribing. to this channel and supporting this channel. This channel is all about helping you guys out. So today I created a few slides with some CNA questions. I'm going to be reading these questions. Please bear in mind that while I'm reading these questions and I'm providing you with the answer, it is important that you can process these answers also by yourself. So, don't depend on me to give you all the answers. Just while I'm reading the question, just think about the answer. So we have question 1. What are the goals of first aid? Take a moment and think about the answer. Is it to activate the EMS, emergency medical system, early CPR and early defibrillation, to prevent death and injuries from becoming worse, to open the airway and give rescue breathing? Take a moment and think about the answer. So the correct answer for this question is to prevent death and injuries from becoming worse. That's the correct answer. So question number 2. Chain of survival action for adults are? Take a moment and think about these answers. Early abdominal thrust, early CPR, early defibrillation, and early access to emergency. Take a moment. So the correct answer is early access to emergency cardiovascular care, early CPR, early defibrillation, and early advanced care. C is the correct answer, and I'm going to bold this question so you have it. Question number 3. A person you are caring for states, I would kill myself if I could find a way. What should you do as the nursing assistant? Call for the nurse at once. Stay with the person. Tell the person that suicide is wrong and call the person's spiritual advisor. Pass the information on when you report off duty. Call the person's family. So take a moment and think about it. I hope you arrive with this answer. Call the nurse at once and stay with the patient because the patient is suicidal. The patient is having suicidal ideations, and as a nursing assistant, you have to report to your charge nurse right away, and you also have to stay with the patient to prevail safety. Question number 4. Which is the most common type of permanent dementia? Take a moment and think about it. Is it alcoholism, Alzheimer's disease, cerebrovascular disease, multi-infarct dementia? So the correct answer for this question is B, Alzheimer's disease. And I'm going to bold this question. Question number 5. You hear an alert, an oriented male nursing center resident make sexual comment to a female resident. What should you do? Tells the male resident to behave. When the male resident's family visit, tell them what happened. Tell the nurse at once. So as we know, we have to report everything to our charge nurse. So C is the correct answer for question number 5. Question number 6. You are weighing an infant, which is incorrect. Take a moment and think about it. Cover the baby with a blanket for warmth. Place a paper on the scale and adjust the scale to 0. Always keep one hand over the infant. Keep one hand on the infant if you need to look away. So the correct answer is cover the baby with a blanket, which is incorrect. So it's A as in alpha is incorrect. So that's the correct answer. Question number 7. A new mother complains of burning on urination. She has a temperature of 100.8 Fahrenheit degrees. What should you do? We check her temperature in 1 hour, ask her if she wants a pain pill, tell her to drink more water, tell the nurse ASAP. So the correct answer will tell the nurse ASAP. We have to report all clinical findings right away to our charge nurse. Question 8. Cystitis is usually treated with high sodium diet, dialysis, antibiotics and fluid and pain meds. Take a moment and think about it. Cystitis is inflammation of the bladder. It's a urinary tract infections. So we treat urinary tract infections with antibiotics and fluids. That's the correct answer, C. I'm going to try to bold it here. Question number 9. What are the major complications of coronary artery disease? Take a moment and think about these answers, guys. They're not that difficult. I mean, they're hard, yes, but they're not that difficult either. Hypertension, angina, and high blood pressure, angina, myocardial infarction, irregular heartbeat, and sudden death. Angina, myocardial infarction, hypertension, and COPD, heart failure, myocardial infarction, and atherosclerosis. So the correct answer is angina, myocardial infarction, irregular heartbeats. That's the correct answer. I'm going to bold that. Question number 10. In diabetes, the body lacks or is unable to use thyroxine, insulin, estrogen, carbohydrates. So the correct answer is insulin. That's the correct answer. Question number 11. The human immunodeficiency virus is spread by insects, saliva, tears and sweats, blood, semen, vaginal secretions, and breast milk, coughing and sneezing. So we all know that HIV is spread through blood-borne pathogens, and C is the correct answer. I'm trying to bold it. Question number 12. A resident fractured her right hip. After surgery, you must keep the right hip abducted at all times. Prevent external rotation of the right hip. Turn and position the person Q4 hours. Keep the right hip flexed. Take a moment and think about it. So the correct answer is to prevent external rotation of the right hip. Therefore, you will prevent dislocation of the hip. That's the correct answer. Question 13. A resident thinks her hearing aid is not working. What should you do first? Change the battery. Check to see if the hearing aid is on. Ask her so. ask her questions, ask her many questions. If she answers correctly, put it in your ear to see if it is working. So what is the correct answer here? A resident tells you the hearing aid is not working. I would check, correct answer is B. I would check to see if the hearing aid is on and if it's placed correctly into the ears. That will be my first intervention as a nursing assistant. Question 14. The recommended position for preventing and treating pressure ulcer is? Take a moment and think about the answers. The answers are not that difficult. You can do it, guys. "30-degree lateral, supine position, prone position, faller's position." So the correct answer is A, 30-degree lateral position. This will prevent any type of pressure. Question number 15. Before applying dry heat or cold application, you need to cleanse the device, cover the device, set a timer, show the client how to change the temperature. Take a moment and think about it. So we have to cover the device because, you know, when you're applying any cold or heat applications, you have to make sure you you gotta cover it because you don't want to apply direct heat or cold to the integumentary system, the skin. You don't want to cause any burn or frostbite, so we have to cover the device with something, with a towel or something. Guys, this is it for this video. I hope you like these questions. I hope you find them informative, and I hope it's providing you with some type of value to your CNA career as a nursing assistant. Thank you so much for watching this video. Thank you for subscribing to my channel, and please continue to like and share these videos, and drop your comments below. Let me know what other videos you would like me to provide you. Thanks for watching and have a great day. Bye for now.